Today they'll be planting some hair in because I've been struggling for a few years with no hair. I tried everything there is. Nothing worked. It works on the YouTube videos, but it didn't work on my hair. I am 39 now. It started about when I was around about 30. Hair is important because it makes you feel beautiful. And for me, not having hair in front, it limits you to certain styles, and you can't wear the style that you would like to wear because of the little hair that you have in front. This will be the last resort. This is my last resort for having some hair in front.
Hi, I'm Professor Frank Greve. I'm a plastic and reconstructive surgeon, and today we're going to do a hair transplant. We have a patient that has frontal hair loss, and she has a bald area in the upper forehead and on the crown of the head, and we're going to take hair from the safer areas at the back where the hair growth is very dense and normal, and we're going to take hair from that area and transplant it to the area in the front which is balding. The technique that we're going to use, we graft follicular units. There's different ways to harvest hair for hair transplants. I prefer to do a technique called follicular unit extraction, where I take hair follicles in a random pattern instead of cutting out a strip. That's the other way. So first we're going to do the harvesting, where we take out follicular units from the back. After we've done the harvesting and we have enough follicular units that we can graft, we're going to numb the area in the front where we're going to graft them to.
To keep my mind and my head straight, I've been feeling as of late that all I want to do is go.
Wherever you want hair to grow, it doesn't grow, and where you don't want hair to grow, it always comes back. Beauty and aesthetics and self-confidence in men and women is related to hair growth, is related to hairstyles, and we're living in a time where fashion is changing quickly, and I see that trend change in hairstyles has a great influence on the way that we deal with hair in the beauty industry and how we structure hair restoration treatments. And we see that for men that had male pattern hair loss or starting to bald, they just shaved the hair off and they walked with skinheads, and it was very, very fashionable. It's still fashionable, but it has changed now. We even see an increase in requests for hair transplants for eyebrows. We see that it started a few years ago in the model industry. Models suddenly had thick and bushy eyebrows again, and it's like a trend. Over the years, people always removed their eyebrows and they had these thin lines, and now the fashion is back and they want big and bushy eyebrows. We see demand for hair transplants for beard. They want nice even beards, full beards. We even see areas like chest areas, pubic hair. So there's a lot of movement in the whole hair restoration industry. The surgery is quite an uncomplicated surgery. The anesthesia is local anesthesia with sometimes mild sedation. The recovery is not that bad. We have to shave the areas to a very short sort of hair length that we can work. We usually advise the patients that we have to wait up to 6 months to see results and to see that the hair comes growing back, and then we can also evaluate the success of the hair transplant.
Wow, it does look amazing. How many hairs did you plant? Did you count?
Well, we planted, I think it was about, look, one graft has about 1 to 4 hairs. I would guess about 1,000 hairs.
So today I'm back at work just a day after the procedure. It was a long procedure. I didn't feel it. It didn't feel that long. I could feel my body was beginning to pain a lot of laying still. It was okay. It was okay. I couldn't feel anything, just a few first needles, but after that it was fine. I could just hear them talking, but everything was fine. So today I'm back from the local anesthetic that they put in. I'm still a little numb at the back, but in front it's starting to pull out a little bit of pain there, but that will also pass. And to look after that, I just need to keep the area in front where they planted it in. I need to just keep it clamped with some saline for about 3 to 5 days, and after that I can wash it with baby shampoo. No scrubbing on it, just put it on and rinse it off, and after 3 weeks I can start scrubbing the area. And in 6 months I'm excited to see what it will be like and what I will look like. Hopefully much better than I looked like before.
I see